So, we have people on both sides of the issue, and we have offered resources and our team to sit down with our hospitals and with our local public health officials and our elected officials to walk through the data points that we're using to make the decisions that we're making. We've said we're open if you've got other metrics, that you're looking at that might factor into what we're doing. I would love to see that. But and the other thing I would ask is, what else would they have us do that we're not already doing? Because again, I'll go back to the example in some of the other states. When they issue a shelter in place, and by the time they account for all of their essential workforce, they've excluded almost 80% of the workforce in their state, and that's the state of Minnesota, that doesn't qualify for the shelter in place. So I believe Iowans don't need an order to do the right thing. I believe they know what they need to do. And again, if they follow through, stay home when they're sick, practice proper hygiene, only go out when you need to, check on those loved ones that are vulnerable to make sure that they have the supplies that they need, we will get through this sooner rather than later.
If you say what you're doing is equivalent to a shelter in place already, why not just call a spade a spade? And
I am not, because it doesn't happen. It's not consistent across the state, and there's no reason for me to do that. We have taken measures all along that we have based on the data that the Department of Public Health has provided to me, along with and working in coordination with the CDC as well as with other factors and surrounding states, and they're bringing all that together and providing me with the information and the data that I've made decisions on. And so I'm going to continue to operate in that manner so that I'm not just reacting, so that I'm not, you've got Governor Cuomo that's saying today or yesterday that maybe I shouldn't have done a shelter in place. So here we go. It is bouncing back and forth, and when you react and you don't base your decisions on data, then you are bouncing back and forth, and that drives fear. You've got to also look at the mental health of Iowans when we're asking them to not go anywhere. So we're trying to be responsible and practical. I want to be consistent in what I'm telling Iowans, and the way that you do that is you base it on data.